The committee will now come back to order. We will continue with support testimony on Assembly Bill 250. We are going to start in Las Vegas. When you're ready, please state and spell your name for the record. You have 2 minutes.
Mawkwest greetings. My name is Barbara Hartzell, B-A-R-B-A-R-A-H-A-R-T-Z-E-L-L. I'm here today as a parent in support of AB 250. My daughter, 2 years ago to this day, was diagnosed with type 1 diabetes. She was sent to the hospital on the verge of a diabetic coma, and we didn't know we were going to bring her home. It was one of the least concerns, but it was also very bittersweet because my daughter is now insulin dependent and will be for the term of her life. Having access to medications, especially affordable prescription drugs, is just one barrier that we could remove from those who are immunocompromised like my daughter, who will continue to face many barriers in their life by having type 1 diabetes. I'm so here to just say how important it is to just having access to prescription drugs. Affordability, whether you're on Medicare or not, is extremely important, and it just helps lift some of the small concerns that you have when you're taking care of a loved one who has to take this medication, and you can't take the things away. I can't take the shots for her. I can't give her a kidney. I just have to support her and love her through this process that will go on. So thank you.
Good evening. My name is Jarrett Clark, and I am the Communications Director of For Our Future Nevada, but today I am testifying here on my own behalf. I strongly urge this committee to approve Assembly Bill 250. And simply put, this legislation will benefit countless Nevadans who rely on insulin and other medications for their well-being. 13 years ago, I was diagnosed with a rare genetic blood disorder that puts me at a very high risk of developing life-threatening blood clots. And managing this condition requires regular doctor visits and a name-brand prescription drug, Xarelto, which has steadily increased in price because there is no generic version of it available. The out-of-pocket cost for this medication is upwards of $700 per month without insurance, which is absolutely absurd since it literally saves lives by preventing strokes, embolism, and heart attacks. Unfortunately, I have been able to maintain private health insurance to shoulder most of that cost, but there are many Nevadans who are not so lucky. As the bill sponsors referenced, under the Inflation Reduction Act, Medicare is now empowered to negotiate drug prices for seniors, and it is expected that the price for the medication I take will soon be negotiated to make it more affordable. AB 250 will extend that negotiated price of specific prescription drugs to all Nevadans who need them. In my work, I regularly speak with Nevadans of all ages who struggle with chronic health conditions, whether that's diabetes, respiratory illnesses, or blood disorders like mine, who have to choose between their life-saving medications and their rent or other bills. People have died. My best friend from college actually passed away from trying to ration his insulin. People's lives are on the line because they are having to ration their medications or skip them because of these exorbitant costs. And this bill is a strong step toward reining in out of control prescription drug prices. Lives will be saved because of it. So I urge you to pass AB 250. Thank you.
Hi, I'm Christine Schackinger, Kristineschackinger. I am a consultant in the state of Nevada. So just to frame what I'm about to say, when I added it up, if you take 3 of the bills that I pay and you add the taxes, I have to make $52,000 a year just to cover them. One of those is a student loan, which isn't that much. One is rent, which is really high, but the other is my healthcare costs. My insurance is $907 a month, which I have to pay for myself. And then on top of that, I have usually about $400 to $700 a month in medical costs. In March 20, I have a very long list of chronic diseases: heart failure, asthma, 2 autoimmune diseases, and diabetes. I have really bad genetics. So in March 2020, I got COVID, and I got long COVID. And among other things it did to me, like liver damage and triglyceride issues, my diabetes went out of control. So it had been under control for 5 years, and it spiked 3.2 points on my A1C, which put me very close to needing insulin. So my doctor added 2 prescriptions to my regime of 12 prescriptions I already take. 4 of those are for diabetes, and that was Farxiga and Ozempic. Insurance did not cover them, so for 6 months I had to get samples from the doctor every month if they had them. Luckily they did. Then I got news that they were going to cover those medications. They did cover Ozempic at $50 a month, the insurance that I had, but the Farxiga was supposedly covered. I went to the Walmart to pick it up, and they asked for $585 for it because the insurance only covered $60 of the medication. So I went home that night and posted on Facebook, I needed this medication to get my diabetes under control from the long COVID, and I don't know what I'm going to do. And a friend said, I go to Mexico to get my drugs. I can get your drugs there. So my friend goes to Mexico, and I've gone once, and picks up my drugs in Mexico. Farxiga in Mexico is $60 a month, and if I get 3 of them, I get 1 thrown in for free. So it's $585 here, or I have to go to Mexico myself or have a friend pick it up. If my friend had not offered to do that, I don't know what I would have done, because there's no way I could afford, on top of my current medical costs, and even though I make good money, another $585. My out-of-pocket last year was $20,000 because I also had 2 cancers. So every month, I shell out at least $1,200 to $1,500 a month in basic medical costs for my prescriptions and my insurance. I've done that almost every year since I was 24 years old.
Can you wrap up?
I'll finish, yeah.
Thank you.
Sure. So all I'm saying is we need your help. As you can hear from everybody here, it's too expensive. We can't afford to take our medications. We can't afford to buy our medications. And I have to go to Mexico to get mine. And I really shouldn't have to do that. So we need you to help us. Thank you.
Thank you for your testimony. Is there? You can start when you're ready. Please state and spell your name for the record.
Yes, thank you, members of the committee. My name is Ariel Guevara. That's Ariel. Guevara, Guevara. I am a regional organizing director with For Our Future Nevada. However, today I am testifying on behalf of community member Elizabeth Yanez. She is an active registered nurse who lives in Assembly District 9. So without further ado here, hello everyone. My name is Elizabeth Yanez. I'm currently a registered nurse who previously worked in case management for an active healthcare company. During my time as a case manager, I cared for the needs of numerous Medicare eligible patients in Southern Nevada. So many of my patients, even when covered through Medicare, would still have lapses in coverage that would require them to choose between paying for expensive treatment or resigning themselves to a poor physical quality of life. Unfortunately, as many of my patients were disabled due to their conditions, this meant they were also living on fixed incomes and unable to re-enter the workforce to make ends meet. Enacting a bill like AB 250 would drastically improve the lives of so many of my former patients that simply weren't able to afford the unspeakably expensive prescriptions that Medicare plans or social services were unable to provide. These medications are necessary to save lives. I've had patients take out personal loans just to be able to afford their life-saving medications. I felt powerless in a system that is meant to cherish life, not diminish it. This is wrong, and the state of Nevada should do everything in its power to make these important medications accessible to those in the most dire need of them. I urge this committee to pass AB 250 and in doing so protect the needs of Nevada's most vulnerable communities. Thank you for your time.
Thank you. We are now going to move to the phone lines. Broadcast, is there anyone on the phones wishing to testify in support of Assembly Bill 250?
Callers, if you'd like to testify in support of Assembly Bill 250, please press star 9 now to take your place in the queue. Caller with the last 3 digits 653, you may begin. Caller with the last 3 digits of 653, is your phone unmuted?
Hi, I'm reading for Dora Martinez, and this says, "Hi Dora, today in Assembly Commerce While 565,000 Nevada seniors, about 17% of the population, are enrolled in Medicare, will soon enjoy the benefits of the negotiated prices of some of the most expensive prescription medicines. About 2.5 million Nevadans are subjected to the full cost that the pharmaceutical companies can charge us for Assembly Bill 250. Ensure that all residents have access to affordable prescriptions. The cost of prescription drugs has been steadily increasing and has made it difficult for many people to access the medications they need. By adopting a law that requires the state to use the negotiated prices of pharmaceutical drugs in Medicare, Nevada can help to make prescription drugs more affordable for all residents, regardless of their income level or health insurance status. Reduce healthcare costs. High prescription drug costs not only impact individual patients, but they also contribute to higher healthcare costs overall. By lowering prescription drug costs, Nevada can help to reduce healthcare costs for everyone in the state, including individuals, families, and businesses. Thank you. We support AB 250.
Thank you for your testimony. Broadcast, is there anyone else on the line?
Hi, my name is Ellen Eversole, E-L-L-E-N, last name Eversole, E-V-E-R-S-O-L-E. I am an advanced practice nurse and a professor teaching our future nurses in Southern Nevada. I have been a registered nurse since 1985, and in all of those years, almost 40, in healthcare, I've witnessed the skyrocketing cost of prescription drugs and the tremendous profits that the pharmaceutical companies are making. While this is happening, many of my patients have no choice but to pay bills in lieu of buying much-needed medications to live on, some even ration medications. There are 65 million Medicare enrollees, and since Medicare has the power to negotiate the price of life-saving medications, by passing AB 250, we can definitely ensure that fairly negotiated prices will benefit all Nevadans who need drugs to live another day. On a side note, just recently in the clinical setting, I witnessed a little boy come in to the emergency room seizing. Father was he was so upset, he was distraught because he hadn't had the money to pay for anti-seizure medications. So please pass AB 250. It's really important. Thank you.
Thank you for your testimony. Broadcast, is there anyone else on the line?
Chair, there are no more callers in support at this time.
Great, thank you so much. So we have 40 seconds left for support testimony. So if you guys want to just very quickly.
John Abel, representing LVPPA down in Vegas, on behalf of our retirees who are made to leave our health trust when they're 65 and have to go on to Medicare. Thank you. In support of the bill.
Maria Teresa Lieberman Barraga, I won't spell it, with Battleborn Progress, and we are in strong support.
Tess Opferman with the Human Services Network, also strongly in support.
Hello, my name is Eric Jing with One API Nevada. Among disaggregated healthcare cost data, nationally, Filipino Americans have the highest cost for prescription drugs, and over half of our Asian Pacific Islander here are Filipinos. So we urge for support for AB 250. Thank you.
Thank you. We will now move on to testimony in opposition to Assembly Bill 250. Is there anyone here in Carson City wishing to testify in opposition? Please state and spell your name for the record, and you may begin when you're ready.
So my name is Paul Cath, that's spelled C-A-T-H-A, and I represent the Culinary Workers Union Local 226. The Culinary Union is opposed to AB 250 this session, and the union wasn't involved in crafting the amendment, and we don't understand exactly why it's being presented. We'd like to work on the issue next session when we have clear direction from the federal government about this law, which goes into effect in 2026. The Culinary and its parent union Unite Here, the AFL-CIO, and many other unions have long supported state and federal policies to address the prescription drug price gouging and ensure patients can access affordable prescription medications. The union knows that there are a lot of new legislators, and we'll make sure to share our past work on prescription drugs. The Culinary Union was the primary force behind the first insulin transparency law in the nation here in 2017, expansion of that to all drugs in 2019 and 2021, and we're partners in 5 bills coming out of the 2019 drug cost study, 2 of which have been enacted and 1 of which is being considered this session. The Culinary Union agrees that drug prices need major reform, but the process to do so needs to include those in Nevada that are responsible for providing prescriptions to patients. The process being used here does not. The union is currently involved in nationally in pushing for prescription drug price reform and have been part of consumer voices supporting last year's Inflation Reduction Act, which includes this new Medicare negotiating role. The Culinary Union is currently working to improve the law, including supporting bills that Senator Catherine Cortez Masto and Amy Klobuchar released this week, the Lower Drug Costs for Families Act. As some of you know, the Culinary Health Fund operates 2 of the busiest pharmacies in the state and provides comprehensive prescription drug benefits for 125,000 people in Nevada. This bill has had no stakeholder involvement that the union is aware of. This is similar to the launch of another healthcare coverage experiment last session, introduced late in the session in the first house without stakeholders in the state actually have to manage the experiment. Working people won't feel the impact of this bill at least until 2026, and the union feels this bill will not build Nevadans' confidence in their government. The union would ask your support in allowing us and others that are involved in helping Nevadans get their prescription drugs to include stakeholders and to carefully consider the impact of introducing this and future complex healthcare legislation. Thank you.
I don't think I can speed talk. For the record, thank you, Assemblywoman. Thank you, Chair. My name is Babette Bond, and I am the Policy Director, Vice President for Culinary Health Fund, and I also work on this bill nationally, actually, and was part of getting Medicare negotiations started. I am uncomfortably on this side of the table, and I hope I see you on the flip side of the table by next session. But this is the first time I've ever had to oppose a prescription drug reform bill, and I'm sorry to be here, actually. I need an extra minute or a few seconds to talk to Assemblyman O'Neill's question, which was regarding some statements made by Ms. Marshall at the table. I'd like to say that the 2017 bill on insulin did not reach into other states. It did not put Nevada ahead of its skis. It did not trigger anything on patent law. It did not trigger anything on commerce law. It actually was held up in court. We had a fight about the trade secret piece in the end. But that bill lived on, and actually, we were the first ones to work on insulin, and now, 6 years later, insulin companies are lowering their prices. So I just wanted an extra second on that. And but it does go to our next point, which is, here's our concerns. Why are we not just trying to protect Nevada? It would be much better if the legal challenges could be followed by another state. We don't need to be first in nation. There's no gain in it, and no one can say that pharma won't sue. To my previous comments, all of those things were true about the insulin bill. LCB helped write the insulin bill. They vetted it, and we still got sued. So I just want to make sure we understand what might be happening next. The federal Medicare bill doesn't take effect till 2026, which we have talked a lot about. But I want to make sure everybody understands the drug prices won't even be known until September 2024, and we come right back into session in the beginning of 2025. So, you know, what are we trying to do? We don't include all the patients. We don't know who. We haven't had conversations with the patients. We haven't had conversations. They're here today, though, thank goodness. We don't know what the PBMs are going to do about this. We don't know how it's going to affect 340B pricing. We don't know how it's going to affect negotiations. And then what happens if we don't include all patients? The amendment today, we saw, that's the first time we've seen it. It's a good example of the rest of this process. It appeared this morning. We've never seen a definition for private health plan that's in that amendment. I don't know what a private health plan is supposed to be, and we're not interested in solving this only for our plans anyway, if that was the attempt. And what happens if prices could be negotiated or now off the table because the state law gives the manufacturers an excuse to charge more? We've frankly never seen a ceiling price that is not a floor price. We have never seen it. Finally, this is entirely possible because CMS is running into trouble federally, and I can provide information for the committee about what's going on in the federal fight to try to make these drug prices more manageable. We don't know what the price applicability period is. You heard a little bit about that in the amendment. The drugs can be moved back out of maximum price after being part of maximum price for a while. How do we get to know, how do we tell the patients that? This bill is going to be led by Nevada, not CMS. CMS is going to talk to Medicare. We're going to have to talk to everybody else.
Mrs. Bonds, can you wrap up your testimony, please?
Yes,
Your
thank
time
you.
has ended.
No, thank you. Yeah, our problems with the process. We want to stop launching large healthcare experiments in the Nevada legislative session halfway through the session. We'd appreciate not having a round 3 of this next session, and we'd really like a participation process where everybody gets to come to the table to create great legislation. Thank you.
Good evening, Chair Marzola and members. Brian Warren with the Biotechnology Innovation Organization. That's BRIAN, and we are a national trade association representing small and large biotech companies. And we have a number of concerns with this bill. I think first and foremost that the maximum fair price is being used in a very different way in this bill than it is being used at the federal Medicare program. This bill does not reflect the realities of the prescription drug supply chain, and it could unintentionally risk access to medicines that patients are currently using. Pharmacies, hospitals, and doctors that provide medicines to patients in Nevada have to buy those medicines. Most of those transactions are not in-state transactions, but they're purchased from national distributors or through regional and sometimes multi-state purchasing consortiums. Excuse me. Even if you had an in-state distributor that was able to have an in-state transaction with a provider, that in-state distributor was buying it from a national price. So either way, somebody is going to be buying it based on the national price and then told you can't sell it for the same price that you bought it for. So these are providers that are going to be put in an untenable position of saying, do I lose money every time I give this drug to a patient, or do I not stock this prescription drug at all? And that's a big problem that we see with this. Secondly, this bill misapplies the MFP as a cap on consumer spending. The maximum fair price is supposed to be an upper limit for what a Medicare Part D plan can pay for a drug, not an out-of-pocket cap. AB 250 isn't for Medicare patients, but it's supposed to be for everyone else. However, most patients with some type of coverage in Nevada right now are already should be paying less for their prescription drugs than what these MFPs likely will be. The MFP is likely going to be somewhere, based on the benchmarks in the federal law, I'd say like roughly maybe 40% of list price, for example. But then if you're talking about a $2,000 drug, you're still talking about, you know, maybe an $800 cost for the patient, which is more than what their out-of-pocket cost may be now. And then our third overarching concern just has to do with price controls in general and what those do for the impact on investment in future innovations. And the Congressional Budget Office estimated that the federal law would reduce
Sir, can you wrap up
investments.
your testimony?
Yes,
Your
I will.
time's up.
Yes. So because of that, we oppose this bill as well. Thank you.
Good afternoon, Madam Chair, members of the committee. Thank you for the opportunity to speak on AB 250. I am Liz McMiniman with the Retail Association in Nevada, and I represent those pharmacies in Nevada that this bill will apply to. I appreciate and understand the position that the Assemblywoman is bringing forward with this bill. I understand prescription drugs are at an all-time high for patients in Nevada and nationwide. Rand believes, though, that this issue begins with oversight and regulation and transparency of the prescription benefit managers. I was almost going to say manipulators, but I changed my mind. And that matter is being addressed by this committee and another bill. However, Rand believes that AB 250 will not have the effect that this sponsor is trying to address. And I appreciate her willing to work with us. This bill takes benchmarks on drugs established at the federal level that are not even fully defined yet, nor are they even in effect. The MFP, as we're talking about today, may not align with the acquisition costs that our pharmacies have had to pay for the drugs. So reimbursement to a pharmacy may put patients in Nevada at a risk of not even being able to obtain their medications in our state with this bill. There's no further definitions or descriptions of the dispensing fee that would need to be calculated differently. MFPs are specifically designed and calculated with value points for the Medicare population. These values will not necessarily apply to the other populations in our state. I heard a lot of that today, thinking that, this might work. If the pharmacy is unable to acquire the medication at the government price, the medication will not be available to the patient in Nevada. For these reasons and others, the Retail Association opposes AB 250, and we look forward to working with the sponsors, and I appreciate that. It would be nice to be part of the stakeholders group. Thank you very much, Madam Chair.
Thank you for your testimony.
Good afternoon, Chair and members of the committee. For the record, I'm Daria McGrew, DHARIA, MCGREW, Director of State Policy at PhRMA, the trade association representing the country's leading biopharmaceutical companies. I'm here today in respectful opposition to AB 250. We can all agree that patient out-of-pocket costs are too high, and we need to come together to make changes in order to ensure patients can afford their medications. I know you're sick of finger-pointing, and this is an important conversation, but there is simply no evidence that this type of policy will lower the price of drugs for patients. The data show that drug prices are down, growing slower than inflation for 5 years now, but I know it doesn't feel that way to the patients. The stories we've heard today and that you hear from your constituents are heartbreaking. But nearly every story you've heard today is about insurance. Insurance just doesn't work the way it used to. Plans and PBMs have been shifting more costs to patients for years through high deductibles, co-insurance, specialty tiers, exclusions. You have to remember that the plans and the PBMs control what patients pay out of pocket, not the manufacturers. Unfortunately, nothing in this bill requires plans to reduce your copay. It does not make plans give everyone the Medicare copay. And as was mentioned, MFP is not the same as the Medicare copay. They are different things. Next, the bill is premature. It skips right past transparency and data collection and analysis. Nevada's APCD, All Payer, All Claims database, is just getting launched, and the transparency program, by its own account, is drastically underfunded, and this bill does not address that. MFP determination is underway and is in the very first stages of implementation. Complex operational and legal issues remain to be worked out. It was noted that IRA is focused on Medicare, and that is a key point to return to. The Medicare population is significantly older and more disabled than Nevada at large. On top of that, the demographics here, the third most diverse state in the country, are different from the US Medicare population. CMS will not just be looking at prices and setting a price, they will also be evaluating data sets, and they will be evaluating data sets based on a lens of looking at Medicare population, and that may work counter to what are the needs of Nevada. Also important, AB 250 defers all decisions and power to CMS without any input from healthcare experts who know the needs and disparities here in Nevada. There are no mechanisms to change or override those decisions if there are regional or demographic needs different from the Medicare population at large. There was some discussion. We do feel that the bill does still raise constitutional concerns, many of which were the same in previous bills that set state price caps. We have concerns about the IRA in general, and state prices reducing access to care and innovation. In every country that sets prices for medicines, it has led to lower access to treatments and cares and treatments. This bill could exacerbate equity gaps and put new medicines at risk. Thank you. PhRMA respectfully requests you not to pass AB 250.
Thank you, Madam Chair. For the record, Danny Thompson, representing PILMA, the Pharmaceutical Industry Labor and Management Association. The union trustees on the association are the International Brotherhood of Electrical Workers, the International Brotherhood of Boilermakers, International Union of Police Associates, the International Union of Sheet Metal, Air, Rail, and Transport Workers, the International Association of Firefighters, the Iron Workers International, the International Union of Operating Engineers, and United Association of Plumbers and Pipefitters. The U.S. biopharmaceutical industry discovers and manufactures medicines that enhance the quality of life and longevity. The U.S. industry is the global leader in research and scientific research, innovation, and manufacturing. It provides hundreds of thousands of high-paying jobs and contributes over $200 billion to the gross domestic product. On average, it costs $2.6 billion and takes 10 years for a medicine to go through the entire R&D process. We're concerned that AB 250 could threaten that progress made in R&D and put the development of new cures at risk. For those reasons, we're opposed to this bill. Thank you.
Thank you for your testimony. Is there anyone else wishing to testify in opposition to Assembly Bill 250? I don't see anyone. Is there anyone in Las Vegas wishing to testify in opposition to Assembly Bill 250? I don't see anyone. Broadcast, is there anyone on the line?
If you'd like to testify in opposition to Assembly Bill 250, please press star 9 now to take your place in the queue.
Hello, this is Peter Guzman from the Latin Chamber of Commerce. Can you hear me okay?
I can, Mr. Guzman. You can go ahead and begin when you're ready.
Thank you so much for allowing me to testify today by phone. The Latin Chamber of Commerce echoes many of the opposition's comments, but further, we are in opposition to this bill because we actually believe it could have opposite effects of what we're trying to do. This could limit access to needed medicines, discriminate against patients, disincentivize the innovation of new medicines, and raise constitutional concerns. So for those reasons and many more that have been already spoken to here, the Latin Chamber of Commerce is in opposition. Thank you so much.
Thank you for your testimony. Broadcast, is there anyone else on the line?
Chair, there are no more callers in opposition at this time.
Thank you. We will move to neutral testimony. Is there anyone here in Carson City wishing to provide testimony in the neutral position to Assembly Bill 250? I don't see anyone. Is there anyone in Las Vegas wishing to testify in the neutral position to Assembly Bill 250? I don't see anyone. Broadcast, is there anyone on the line?
Chair, the public line is open and working, and there are no callers at this time.
Thank you. Assemblywoman, would you like to give some final remarks?
Thank you, Madam Chair. I do not want to go through all of the opposition. It's a late night. Ms. Marshall will tackle some of them. I just want to reread something I said when we started. I've had numerous conversations with stakeholders, listening to their worries about losing profits, the end of private research and development, cost shifting. It's not us, it's them. The system should be fixed first, not now. There's too much going on. It's not us, it's the PBMs. It's not us, it's the insurers. And what I keep going back to is this is about people. This is about giving relief to people. And the Inflation Reduction Act gives us the opportunity to stop those barriers, cut right through it, cut through all of the noise, and provide relief. I am open to work with everyone who wants to work on this. I would like to see this happen. I will work to make this happen, but I want to start with people and work from there. Thank you.
If I may, Madam Chair, Kate Marshall for the record. Thank you for staying here. I don't even know if you guys have had supper. I know that probably what you saw was a lot of people for this and a lot of people against this. But what I saw was a lot of people for this and a lot of people attempting to relitigate the Inflation Reduction Act. This is not the place to relitigate the Inflation Reduction Act. This is the place to incorporate it by reference so that the other 83% of people in Nevada can take advantage of the maximum fair price established by Medicare. A lot of the things that you heard today are solved in the Inflation Reduction Act. Doesn't affect 340B. We have had caps on prices in the VA, in Medicaid, in 340B things. A lot of these things you heard are ways to try to throw pasta against the wall and see what sticks. I was a little disturbed by the notion that we haven't gone to stakeholders. We've had stakeholder meetings. We've called all of them. We've had numerous calls. And indeed, you saw an amendment today to try to address some of the issues so that if you had a collective bargaining agreement, you could choose to opt in. It gives you maximum flexibility for whatever's going on. Unions it's important that they have maximum flexibility. The last thing that I would, if I can remember my notes here. The last thing that I would like to say to you is that you heard that all the people here are already at the table in D.C. That's one of the reasons we wrote the bill the way it is. They're doing all the heavy lifting in D.C. That's why we have 3 fiscal notes that have a 0. We are not doing it here. We are not burdening our state or adding more bureaucracy. The last thing I'll say is that there was a comment made that Nevada doesn't want to be first in the nation. We are first in the nation. We are first in the nation in terms of how bad our health care is. We are first in the nation on so many lists with respect to how our patients are doing. I would like us to get off that first in the nation list. Thank you.
Thank you for your presentation. And I just remind anyone that did not get to testify today, whether in neutral opposition or support, that you can always provide us with your testimony in writing to the committee, please. And with that, I will close the hearing on Assembly Bill 250. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. We are not here to rehear any bills that we heard this afternoon or tonight. Public comment is limited to 2 minutes per person. Please remember to state and spell your name for the record. Is there anyone wishing to provide public comment here in Carson City? I don't see anyone. Is there anyone in Las Vegas wishing to provide public comment? Broadcast, is there anyone on the line wishing to provide public comment?
If you'd like to provide public comment, please press star 9 now to take your place in the queue. Chair, the public line is open and working, and there are no callers at this time.
Thank you. This concludes our meeting for today. Our next meeting will be Wednesday, April 5th at 1:30 p.m. This meeting's adjourned. My agenda's not out yet.